Hi everyone, thanks for listening to my presentations. Today I'll be talking about late talking in children or delayed speaking. Okay, if that is a concern around you, or you are a health practitioner or medical student or nursing student who may encounter this later in life, okay, then sit back and let's reason together. Okay, by definition, no fixed definition for delayed speaking in children. What are the possible signs that we can look out for that will give us clue that truly we are dealing with delayed speaking or late talking in children? At birth, if the child is not responding to noise around him or her, we could feel concerned. By the time the child is mid 1 year and no babbling at all, we should be concerned. At first year birthday celebration, if the child has not been saying words like mama, dada, or papa, we should feel concerned. It should be a warning sign at 1.5 years old if the child could not have 5 words, or at age 2 years, if the child could not be at the stage of being able to combine 2 words, then we know we have a problem. Okay, first thing first, history. We're going to take the name of the child and of course the age. And it is going to be wise to find out about other siblings in the family and if this problem is also in them or was in them at this very age. We have to ascertain what the parents or parents meant by not speaking. We can find out. Do you mean no single word or not speaking fluently to your own, desire or as the standard you set for the family or for the kids or for yourself? Maybe your parents told you when you were at age 6 months, you were all, up and down, speaking fluently and so on. Or at 1 year, you were even reading and so on. And that is what the standard you set for the kids, and now the kid is not meeting up with that and you become concerned. We need to find out. Is there selective mutism? That is, not speaking at home or school or both, or speaking at school but not speaking at home. If speaking at daycare or school but not at home, then we have to rule out child abuse or child neglect. We need to find out about hearing well or not. Is this child responding to call? Has the child ever reacted to sudden loud voice? We need to find out. Okay, still on history. We want to know if there is any ear infection, ear pain, any wasps, any trauma to head or neck region. Still on history, we want to find out if this child is on any medication like aspirin, which is supposed not to be anyway, because we shouldn't be giving aspirin in that age group. Okay, aminoglycosides, diuretics, e.g. lysis. All this, like I said, don't give aspirin in that age group because of possible Reye syndrome. Okay, aminoglycoside, diuretics, and aspirin could all give ototoxicity as a problem. And this is not the complete list of medications that could give ototoxicity, but we could quickly go over this and then as more as history may warrant. Low performance mentally, that is, you are concerned about possible mental retardation. Still on history, want to find out if there is any congenital anomaly, cleft lip and palate, tongue-tie, oral developmental abnormalities, difficulty sucking or difficulty swallowing. Like I've said just a while ago, selective medicine is a big concern. Okay, the mother is complaining right now that the child is not speaking, but at daycare, she was speaking or he was speaking. At school, she was speaking or he was speaking. But on getting home, he or she remains quiet. Then there's problem somewhere. Is there abuse in the house? Is the mother also being abused? Spousal abuse going on? We need to find out. We will quickly brush over autism. And in that wise, we just brush over some few questions like, is this child playing in a corner? Plays alone, not with other children? Plays with a fixed toy? Rocking back and forth on the chair? Can't make eye contact? All this will give us clue that we have autism at hand. And that will lead us to more questions as per autism. We will also try to find out about history of infections in this child, like meningitis, upper respiratory tract infection, otitis media, or even urinary tract infection. Okay, we want to know everything about this child, right? So history of birth. Is it traumatic? Is the pregnancy up to term or premature? What's the mode of the delivery? Okay, is the child up to date as per immunization? How about nutrition? Breastfeeding or not? Formula feed or not? Weaning food, what type? And of course, developmental milestone. And we'll examine through the history what the environment is like. Is this a single mom? Any poverty? Any possibility of abuse or neglect? Are they living in a very old house where lead is possible? And so on. Family history is very important. We need to find out if there is delayed speaking in the parent or in family generally. We must find out about genetic anomalies like Down syndrome, Fragile X, Williams, or tuberous sclerosis. What are the possible risk factors? Poverty and old houses. Of course, that will lead to lead accumulation. Prematurity, low birth weight, positive family history of delayed speaking, learning disabilities, particularly in children with kernicterus, born with massive jaundice, and then with time, the jaundice affects the brain, and they're done with kernicterus. Maternal depression, and that will affect the mom from looking after the child appropriately. Male sex, well, I don't want the males to feel offended because I don't know, the presenter is also a male, right? Autism spectrum disorder and pervasive developmental disorder. Other risk factors are verbal appraisal, lead poisoning, like I've explained, living in old house or at the basement of the old house. Hypothyroidism, this is one of the reasons why thyroid level or thyroid function test is down at birth. Family stress, example, single parent, different languages at home, then the child is confused. differential diagnosis. What could this be? It could be a specific language impairment that could be expressive, receptive, or mixed. It could be globally delayed developmental disorder, or it could even be something that we may not envisage, which is autism. Okay, it could be anxiety. Okay, still on differential diagnosis. The next is selective mutism. This wise, the child is not speaking at home, they're speaking at daycare or speaking at school. Then we should be bothering ourselves. Is any abuse going on here? Any neglect? And we should even ask the mother who has brought the child, have you been abused by your spouse? We need to do that. And even because of selective mutism, when the child is right before us with whoever has brought him or her, I mean the caregiver, we should study the relationship. Are they bonding? Is the child afraid? Is the child okay with the caregiver now walking away? Or we should just use our IQ, right? Dysarthria, as in cerebral palsy, stuttering, hearing loss, bad grammar, and of course, isolated language delay. Okay, we are going to do physical examination. After we've taken the history, we've ruled out all the risk factors, we should check as per the history, then we want to check the child. Okay, we'll look at the general appearance, the speech, the ear, the nose, the throat, and if it's a child that's grown up a bit, we can run IQ test and of course get anomalies. Okay, investigations. We're not going to do all sorts of investigations. It will be restricted to field, like complete blood count, lead, genetics. If that is pointed to it, then we will have to rule out associated genetic disorders, odometry, thyroid function test. Treatment. Treatment may be just a reassurance. Okay? Treat any specific diagnosis through the history, physical examination, and investigation. If you're able to pick any specific one, then we should treat. We should address child abuse, child neglect, poverty, or any other social issue or issues. Still on treatment. Referral may be the appropriate thing when we deem it, necessary, like to speech therapist, or for social skills training, or to pediatrician or child psychologist, or to ENT surgeon if we think ENT surgery will be helpful. And of course, we have to engage the parents this time to be reading to the child and getting him or her fully engaged. Once again, let me reiterate here, there is no phase definition for delayed speaking in children. With that, I've come to the end of this very presentation. Remember to share, remember to subscribe. I appreciate it.